Hi, it's Chris Moore with Senior Remodeling Experts. Welcome to Aging in Place is a Team Sport. It's a video series where we talk to different providers. We explore how families, professionals, and communities can come together to help older adults live safely, comfortably, and independently at home. I'm here to guide you, connect you with the right resources, and help make the rest of your life the best of your life. Welcome back to Aging in Place is a Team Sport. I'm Chris Moore, and I have with me today Ray Parks, who is the Executive Director of the New River Valley Area Agency on Aging. And welcome, Ray. And if you would, tell us a little bit about your background and what all you guys do down there in the New River Valley.
Well, hi, Chris, and thank you very much. Appreciate this chance to tell our story a little bit. My background is I've been in the field of aging services a little over 20 years. And prior to that, I worked for a community services board and was in the field of psychiatric rehabilitation services. The agency I came from prior to starting this position was a combined community services board and area agency on aging. And so I did a little bit of both over the years. But I think where my heart has landed is really a passion for what we call AAAs. Area Agency on Aging is a mouthful. The AAA services, the mission of what we do, and some of the services we're able to offer. So started here January the 16th of this year, and following the retirement of the previous executive director who had a long tenure with this agency and is well known in the community. Tina King is her name. And it was a kind of an easy job to step into based on the fact of what she had built and established, and the reputation of the agency in the community quite positive because of that. So if you like, you want just kind of an overview of what our mission is and who we're serving?
Absolutely. Because I'm sure there are people that are not familiar with what the mandate of the AAAs are and what they are tasked with doing. And maybe I'm sure there's people that don't even know they exist. So I don't think that's a problem in the New River Valley because, as you said, Tina has done a tremendous job over the years, and that agency has been very active and hosted a number of events that I've been privileged to be a part of. But for people that aren't aware of what a AAA is and what it does, a background and would be very helpful.
Okay, happy to do that. It starts with a little bit of a history lesson. We exist because of our federally authorized legislation, which is called the Older Americans Act, and that dates all the way back to the 60s. And that created the space for area agencies on aging to exist. What it established was for each of the 50 states and some of the territories, there's a state unit on aging, and that state unit on aging receives the federal funding from the Older Americans Act and then combines it with some state funding. And then in Virginia, it is dispersed on a funding formula to 25 of what they call PSAs, public service areas. That's the territories, each one of which has an area agency on aging. And so the AAA then, through a contract and through what's called the Area Plan for Aging Services that we have to put together and have approved by the State Unit on Aging, defines the scope of the budget and the services we provide. So that's kind of how it works in practical terms. And in that Area Plan for Aging Services, there's the federal funding, the state funding, and we account for any funding from our localities. In our case, the New River Valley Agency on Aging is what's called a joint exercise of powers. It was established 50 years ago. This is our anniversary year, to serve the counties of Montgomery, Floyd, Giles, and Pulaski, and the city of Radford. And so those 5 jurisdictions plus the towns of Christiansburg, Blacksburg, and Pulaski contribute, have signed a charter, and they representatives from each of those localities make up our board of directors, our advisory council. So that's kind of the governance structure of how we operate. So under all of that, there's certain in that area plan, there are certain core services that we provide. And the State Unit on Aging in Virginia is another acronym, DARS, which stands for the Department for Aging and Rehabilitative Services. They not only fund us, but they regulate us according to the service standards, which comply with that Older Americans Act and also the state service standards. The core services that we provide, one that everybody thinks of, I'm sure, is nutrition. Specifically, what's often branded Meals on Wheels is home delivered meals to individuals who are homebound, don't have anyone to prepare food for them, often live alone, often don't have mobility issues, would have trouble accessing food. The only criteria basically for our services is that you're age 60 and above and just have a demonstrated need for those services. There's, in most AAAs and ours going forward, there's no fee for those nutrition services. We request donations to the extent an individual is able to give, but we don't require it. And so the meals that are delivered to the homes, as well as we have 6 congregate nutrition programs. We call them friendship cafes, and there's one in each of the localities we serve. The meals have to meet certain standards, certain nutrition standards, and we offer those again to adults over age 60. But the difference between eligibility for home delivered meals and the congregate meals is just basically where the person is physically able to be independent and attend a program site. If not, then they're eligible for the homebound service. That's a big one. Nutrition is vitally important for older adults to thrive and maintain health. And one of the benefits of the congregate sites is the socialization that happens there. They also get some disease prevention programs, education, and people typically are more inclined to eat a meal in a social setting when they're talking and making friends and visiting. One of the other overarching goals of our services is to help prevent people being isolated. And that happens very often as people get older, lose family members, lose mobility, lose resources. They can become very isolated. And there have been studies done showing that what they call social isolation for an older adult can be the equivalent of smoking 15 cigarettes a day in terms of health consequences.
I've heard that.
Yes. So it's vitally important that we offer opportunities for people to not be isolated. And so even if they can't attend a congregate site, having the contact with the drivers, providing the meals, and then we do a lot of checking from the main office here. Those things are very important just for the health and well-being. So we've got nutrition. The front door to all of our services is kind of an information and referral service. So often as people age, either for lack of planning or just the fact that a crisis can hit and an older adult's not prepared for it, they're looking for answers and where they can find help. And so we, through an initiative that's called No Wrong Door, we try to be that one-stop shop for individuals to either call or come by or email, however they contact us. We very quickly connect them with a live human being who can start finding resources for any assistance they might need. We have support coordinators. Their title here is Aging and Disability Service Specialist, who will do an intake and really assess the needs of the individual, try to hook them up with whatever supports and services we know of. And we have access to a lot of resources, a lot of databases, and just, of course, local knowledge and a lot of support from the community to help provide those services. So that's that's a big part of it. It's just helping to navigate people to the information and the services and supports they need. You know, it could be a service like yours if they're in need of home modifications and don't have other resources maybe, or meals programs, transportation services. We subcontract and also participate in a regional coalition that helps find people transportation resources for medical appointments, things like that, whatever they might need. And then our agency also houses a position called the Long-Term Care Ombudsman, and that individual supports patients in skilled nursing facilities and assisted living facilities. The individual employee reports to the state Long-Term Care Ombudsman, but they're their goal is really to be present, to have a presence in all of those facilities and to be a patient advocate, try to solve problems and meet needs, and if necessary, network with other providers. As you might, I'm sure you know, a lot of these facilities are struggling in terms of being understaffed. The demand is only increasing as time goes by, and the ombudsman plays a very important role helping the patient experience there to be a success and calling it out if it's not, frankly.
Right. Well, and Janet Brennan is a force to be reckoned with.
Absolutely. Yes. I want to be on her good side. And she's a very, very gracious lady, but a very fierce advocate.
Yeah. Yeah. So do you find that people that need the services that you provide are often reluctant to come forward? One of the things that I run into all the time is that it seems like the people that need my services the most are often the least forthcoming to ask for them. And as I've grappled with this reality, it seems that a large portion of that reluctance is based on the negative perception that we have in our society of aging. And so people don't want to think about getting older, and somehow in their minds, they think that asking for help indicates a weakness or a surrender to the ravages of aging. And it's something that I'm very, very involved with trying to bring to light and trying to correct in whatever small way I can. I'm writing a book called Age Out Loud and encouraging people to be proud of their age and to be proactive and to be willing and able to attempt the dreams that they have and the aspirations that they have, and not be afraid to try to accomplish great things regardless of their age. But I'm curious what your experience with regard to that reluctance is in terms of reaching people who really would benefit from services but are hesitant to ask for them.
Well, you're absolutely right. And many times the initial contact we receive is not from the individual needing the services, but a family member, a neighbor, someone noticing that, they're maybe in decline or not thriving and need some help. And so, obviously we protect privacy and we have to obtain consent to talk to anybody, and can't disclose their information. But a lot of times those contacts will persuade the individual to get in touch with us or allow us to contact them and go forward with trying to assess the needs and try to see how we can help. I think there is a very natural denial. I'm of age to be eligible for these services too, and I have to remind myself of that sometimes. And I think there's a stigma that goes along with being perceived as a person in need. One of the things I like about the Older Americans Act and the way it's set up is it is not a means-tested program. You don't have to be of a certain low income or a certain health condition. These are programs designed not just to meet crisis situations, but to actually promote things like good nutrition, health and wellness, socialization, things like insurance counseling, what it takes, the practical things to be able to age in community or age in place rather than to succumb to being institutionalized prematurely because not having the resources to live as independently as possible. That's really the main focus of what we do. And almost everybody you talk to will say, I want to age in place. I want to stay where I am. And sometimes that means maybe not necessarily aging in the same house or the same structure, but at least being able to age in the community of their choice, have the resources to, find a living situation that will enable them not to have to be more dependent than necessary. But I don't think people understand that. I think you're right. I think there is a definite need to keep putting that positive message out about what things we can offer to come alongside people and help them live according to their choices, not confining them because of age or stigmatizing what they can and can't do. So that's kind of the spirit and the flavor of the Older Americans Act, and that is the part I like. We're mandated to serve people who are most in need, but where that really comes into play is if there's this under-resourced service, which we have some, and there are waiting lists, then we have to prioritize those waiting lists according to economic need, social need, those kind of things. But our thrust is really to serve anybody and everybody, age 60 and up. If it's a person with dementia, it's age 55 and up. With the different services we can provide. Yeah, it's in our congregate sites, often a person is hesitant to join and to see themselves as a member of a group like that. But if they can come in as a volunteer and see a helping role, in the end, they're getting the same service. It's just having a different perception of the purpose of it.
Wow. Yeah, that's a good point. You had mentioned in your introduction that you are funded partially with federal funds and that you're partially under the purview of the state, and then the local municipalities are also providing funds. Are there ever conflicts between these different state, local, and federal guidelines that you're accountable to make everybody happy?
Not too often. I mean, the state derives their guidelines from the Older Americans Act, from the federal code. And then the localities don't have as much of a regulatory role. I mean, we're highly regulated just by the nature of being monitored by the State Unit on Aging, and then any other local codes that would apply to any other agency apply to us, obviously. So, no, I can't really say that I see them in conflict. The only conflict is, as always, is lacking the funding to have the infrastructure to do everything we feel like we need to do.
Right. Right. Well, we do a good amount of grant work for disabled veterans, and in the grant work we have to comply with the VA's requirements. And there was one job in particular that stands out, that the wheelchair ramp we built in the backyard, the federal guidelines called for the handrails to extend a foot past the end of the ramp, and the county building inspector wanted them to stop even with the end of the ramp. So we had to figure out who we were gonna please in that case. That was the source of my question. You know,
The closest comparison that we come to that is with nutrition services and the guidelines we have to follow for nutrition. You know, they have to be low salt, low fat, heart smart type of diet. So a lot of our clients would tell you no taste.
right.
So, and high in nutrients, high in fiber, those kind of things. So once our members understand why we have to provide it the way we do, then, you know, if they pull a salt shaker out of their purse and season it up, it's their business. It's not ours. We just have to provide it the way the mandate requires us to.
Right. What is your perception of the changing demographics over the next whatever time frame you would like to address, but clearly one of the things is that as a society we're aging, and the percentages of older adults compared to the general population continues to grow, and I'm sure that's something that is on your radar as your contingent population continues to increase, and I'm sure that the funds don't necessarily increase in the same proportions. And then how do you meet the needs of a growing population?
Absolutely. As I'm sure you're aware, we're approaching a threshold where the population over 60 is going to exceed the population under 18. And, you know, we've been aware of this increase for some time, and it definitely puts more demand for services. And two, the younger, older adults that are coming into need services now have some different expectations, have some different needs. They're not necessarily content to sit in one room and play bingo for 3 hours. They want some education, some wellness. They want to get out into be part of the community, those kind of things. So it does challenge us with the resources we have to try and do some more relevant programming. A lot of older adults are working longer. They don't have time to go to a senior center or a friendship cafe for a long period of time. They need to be in and out. They're balancing a lot of different things still. A lot of older adults raising grandchildren. And that gets into the whole area of caregiver supports, respite care, kinship care for family caregivers, those kind of things. Part of our agency's mission is to be a support for that as well, and to come alongside family caregivers with resources, respite type programming. We do an annual caregiver conference. It's kind of one of our signature events, and bring together a lot of providers and have some training and education, and hopefully a sense of support to caregivers in the region. And we want to do more of that. We want to partner with other providers and entities in the region that are doing things like caregiver education and support groups and those kind of things. That's a big part of our agenda for the coming fiscal year, is to increase our involvement in that, because the need is definitely there, and it's increasing for the caregivers as well as the older adults that are aging out at a rapid rate. A lot of Virginia, especially the rural parts, has long been ahead of the national average for the percentage of older adults. So, yeah, it's incumbent on us to keep that in focus.
Yeah. Well, I have been to your caregiver conference a number of times and always find it to be very helpful and very, very well received, because people often become caregivers suddenly, and they're not prepared. They don't know what questions to ask. They don't know certainly who they can trust. They're really, it can be very overwhelming. And, you're trying to deal with health issues and trying to learn about, the medical care that your loved one needs, and then figure out how to balance your own life and keep, many people are working full time and trying to care for, a family member. When they're at work, they're thinking about their family member. And when they're at home, they're thinking about the work they didn't get done. And it can be really a very, very devastating, overwhelming kind of situation to be in.
Absolutely. Another thing that reminds me of is, the strength being by default sort of thinly resourced to do what we're doing. There's power in the networking and the coalitions in this region. For instance, there's a network called Aging and Community. There's another one called Thrive, which deals with food insecurity. We partner with all these different networks. And what Aging and Community has done over the years is create a resource, a workbook for successful aging. And they actually do workshops. And it's all about preparedness, helping people before the crisis hits think through what the needs are that go hand in hand with aging. If your financial resources change, if your health situation change, if your housing needs change, mobility and transportation, all those things, it's a resource that helps people think through those possibilities, before the time comes, or at least in real time. And in a lot of ways, it can prevent crisis situations, especially if that information and those kind of decisions are communicated with family members and decisions are made in concert. It can really help. We get a lot of good feedback for that. So, and another thing that's kind of a subset of that, and a big part of what our agency does under a separate contract, is insurance counseling. We have a program called the acronym is VCAP, which is Virginia Insurance Counseling and Assistance Program. It's part of a national state health insurance program network. And I think ours here is pretty strong, but starting October 15th and going through December 7th is pretty much the schedule every year, which coincides with the Medicare Part D open enrollment period. And all you have to do is turn on a television and you see all kinds of ads and Medicare Advantage plans coming at you, and people say, you get the phone call, sign up for this, sign up for that. What we're able to do with this program, and I mean, it operates year round, but I guess prime time is during open enrollment, is provide free, unbiased counseling service that compares plans based on an assessment of the individual's needs, where they live, who their doctor is, what medications they're on, look at premiums, compare those prices, and really help them to make a decision on what's their best value. And it saves thousands and thousands of dollars. We keep statistics on that in premiums for these adults, just going through that counseling process and making better choices. So that's a big deal. Insurance costs for people as they age and having adequate coverage.
So does that VCAP program focus exclusively on Medicare, or do they also deal with like life insurance, homeowners insurance, long-term care insurance, any other types of insurance that people may have questions about?
It's primarily Medicare beneficiaries, and they have some expertise too in long-term care insurance. But I would say, based on what we do with information and assistance and referrals through our network, if people have questions and issues with any of those categories, even if we don't provide the service or the answers, we'll help find someone who does.
Okay, no wrong door, right? Yeah.
So
Wow.
that is a very another part of what we do that you just hear so much, frankly, gratitude and appreciation from people who have someone to walk them through that process. And a lot of people get their appointments every year during open enrollment just to get a checkup, see if they're, because things change year to year.
Right.
I myself have gone through the process with my wife, and this year, I'm eligible for Medicare, and so I'll be talking to one of our counselors and getting some guidance myself, so that when I enroll, I don't make any wrong turns. So it's a good resource.
Yeah. Well, so many things are so complicated in our world today. Insurance is a good example, but there's so many others that, you just, I was listening to, I think it was Ken Deichtwald, and he gave the keynote address and I think it was a convention of the AAAs recently, and he was talking about his first Medicare document after he signed up for Medicare, and at the top left corner it said, "This is your Medicare bill," and at the top right corner it said, "This is not a bill." So, which
people getting phone calls and thinking this is Medicare calling. And of course, Medicare will not call you. It's either a scammer or an insurance salesman trying to get a foot in the door.
Yeah. Well, that brings up a good point. Fraud is a huge problem across the board, but especially among older people, because they are viewed often as an easy target by fraudsters, and that compounds the social isolation, because if someone is isolated and doesn't have strong social connections and family and friends and people that they could maybe run something by before they make a decision, they're that much more vulnerable to different forms of fraud. Yeah. So do you all, I feel like I'm sure you work in that area in some capacity.
What we have we are a contractor for a little program called the Senior Medicare Patrol, which primarily works to educate older adults how to recognize fraud and prevent it. Also, how to read explanation of benefits and doctor bills and things like that to make sure they're not being charged inappropriately.
Right.
We work also in conjunction with local groups. There's one, I think the Sheriff's Department is affiliated with a group called Triad that is very active in educating about different scams and fraud. So, just in partnership, and also through our Senior Medicare Patrol, we do actively try to help people not get scammed and know what to look for. So it's very important. And the consequences, and I'm sure you've seen this too, for people who have gotten taken by a scam or by a fraud, a lot of times it's just devastating financially. There's these romance scams that can be very devastating. And so people are so embarrassed having been taken advantage of, and it actually leads to more isolation because don't want to share it. They don't want to talk about it. They don't want to be seen. They feel stupid for having um, been vulnerable, so it really can put a person in a downward spiral if they get caught by one of those things.
So you wear a lot of hats.
I have a team with a lot of
Uh-huh.
hats. I'll put it
Right.
that way.
Right.
It's really interesting. This is the second AAA, like I told you, I've worked in, and they basically all do the same thing, just in a little different ways to adapt to the different places they operate in. And there's certain challenges for a rural area, especially transportation and
Sure.
the isolation piece that you might not have in another area. So, but the core services and the things you're able to start doing in partnership, there's a lot of variety in it. I think the essence of what a AAA does is fill gaps where there aren't other services.
Right.
You'll find some that are coordinated with community action councils, maybe working in housing, just different things where the needs are. A lot of times the AAA is a lead partner.
So what would you say to the person that's listening to, or watching this, and they weren't aware that you existed, and they live in your service area, which again is Montgomery, Pulaski, and
Giles,
and the city of Radford, the town of Christiansburg and Blacksburg. And they live in that area, or they have a loved one that does, that thinks that you might be able to help. What's their best move?
Any way they can contact us. We have a central number, 540-980-7720. It comes into this office and gets the person set up pretty quickly with a live human being that can start seeing what kind of supports they might need. We have a website, a.org, that stands for New River Valley Agency on Aging.org. All our information is there. We have a Facebook page, and a lot of times people just drop in. We're here at 44 3rd Street, right in downtown Pulaski, and get a fair amount of foot traffic. People just coming in and presenting a need. So yeah, any kind of way that we can make contact with someone, we want to get them in the door and see what we can do for them.
Okay, very good. Now, on the other side of that equation, you mentioned volunteering. I'm sure you're open to donations if people are in a position to give you financial donations. Any other ways that people that might be in a position to help out your mission besides volunteering and donating, and what types of volunteers specifically are you in need of right now?
For our agency specifically, most helpful volunteering would be for our congregate nutrition programs. They're called Friendship Cafes, just to help with support for the staff there. Each cafe is operated by only one part-time staff person. So we depend on volunteers to help operate the programs, do the meal service for the day, and some of the programming as well. That would be a primary way. Another type of volunteer that is very helpful, we have an advisory council, and it's made up of individuals from the community in each of the jurisdictions we serve. And we have a few vacancies on there now. So if anyone would be interested in joining our advisory council, basically receiving reports about our programs and giving us counsel and advice about how to develop our area plan each year, that's a great way for some people to participate. So it all helps.
Yeah, very good. Anything I've missed? Anything that you'd like to add?
I think just being able to promote the help that's available. We're always behind the curve of people getting into a situation and not knowing where to turn and not knowing who to call. So the more information we can put out, and make the awareness of us as an agency and as a service provider and the different partners we have in the community, I think that's just so important. Getting people to think through the issues and maybe do a little planning and preparation, and also advocate for the type of services that we provide. Those are the main things I think that would be the big ask at this point.
Yeah. Well, I think you brought up that, the benefit of planning and being proactive and kind of thinking about your needs before you have them. And I agree wholeheartedly that that's a great benefit. And in my experience, it's the people that have been caregivers that are most likely to be willing to consider that planning ahead and being proactive.
Right.
Because they've kind of seen the other side of the coin and recognize how difficult, it can be to care for somebody without any planning and in crisis mode and trying to patch some kind of Band-Aid type approach together at the last minute because you have not prepared.
Exactly. Yeah, I think that is important. And then the other side of the coin is having a resource to go to if you are in a crisis, and somebody to come alongside and guide you through
the
connections you need to make. It means everything.
Definitely. Yeah.
So it's great work, and I appreciate the chance to tell our story. And, I wouldn't want to be anywhere else, to be honest.
Well, very good. Well, thank you for coming on, and thank you for telling our viewers about what you have to offer, and hopefully somebody will see this that can connect with you and get some help or provide some resources. And so thanks again for being on, Ray. And thank you all for watching. Aging in Place is a team sport.